Hello, I'm Dr. Elizabeth Coyne, and I'm just going to go over an introduction to Module 2. Now, Module 2 is really about where you identify a problem and then start actually working through and thinking how you could change and improve practice and actually have it translate to a practice change. So there's a couple of topics within this module. The first one's looking at translating research to practice. So this is about understanding what research is best practice, how you might actually go about finding what is the need for practice change, and how you then translate that into practice change. We'll also look at some frameworks that help us sort of look at a clinical practice problem and how you might do that. Now that really relates to your assessment item 2. And we're also going to look at developing a timeline and budget for translating your idea from research into actually practice change. Now that's part of assessment item 3. And so when you're looking at this module, remember to keep reviewing what you're expected to do for assessment item 2 and 3. Make sure you look at the topics in the module and start writing notes and making sure you're remembering to add them into your assessment item 2 and 3. So as you're going over this module, really think about what it's trying to tell you. It's going to help you identify the need for change, what is best practice, which is looking at the actual evidence and clinical research that's been done. And then who is involved in this practice change? What voices, so consumer voices, do you need to have in those conversations? So whether this is patients, families, or the nurses around you, or is it the health professionals around you? So think about sort of what consumers' voice are needed in your practice change idea. And then we're also going to look at sort of the culture of change and how to sustain that practice change. And so this is going to also then be looked at in more depth in module 3. But looking at the sort of the culture of change and how we actually engage with consumers and the stakeholders to actually maintain that practice change. And the last thing I want you to always, as you're going through these modules, reflect on your own practice area and what needs to be changed and how does that actually influence by your role as an advanced practitioner.